Welcome to Rescue Care. I'm your host, Thokozani. This program will talk about different health issues. Today we'll talk about malaria. Today we will learn everything we need to know about malaria. As always, I'm always joined by an expert. May you please introduce yourself?
My name is Thokozani Mlongoti. I'm a child health nurse at Thokozani Hospital.
So, first of all, can you tell us what it means when we say malaria and what happens when a person gets malaria?
Malaria is a life-threatening condition, and it is spread to human by mosquito. And this malaria is common in tropic countries, and it can be preventable, and it's also curable. Yes.
So, can you tell us why malaria is common in Malawi?
Malaria is common in Malawi maybe because of different climatic changes in Malawi, and this poverty also contribute to increasing case of malaria, and also this limited access to preventive measures. This one can be the most serious one. Yes.
So, do you know what the main symptoms of malaria are?
Yes. The symptoms of malaria ranges from mild to severe. In mild cases, there is this fever, chills, headache, general body pains, maybe nausea, yes, sometimes vomiting, and in severe cases, one can present with seizures, convulsions, difficulty in breathing, yes, difficulty in walking, yes, confusion, yeah.
So, can you tell us where a person can get the diagnosis about malaria?
Most malaria can be diagnosed in hospitals, yes, and there's this what we call lab test malaria. Yes, this one, if one is positive, present with 2 lines, and if he is negative, present with a single line. And there's this also called malaria blood film. This one we do it in the laboratories, and they use microscope to detect the presence of plasmodium, and they count it according to pluses. Yes, if the person is +1, it's mild, and if it's +4, the malaria is in severe form. Yeah.
So, for example, when someone has got malaria, can we transfer to someone else?
Yes, it's possible. It can be transmitted as long as the one having infection is being bitten by the infected mosquito. Yes, and that the same infected mosquito bites another person. The malaria can be transmitted from one person to another by the infected mosquito.
So, when malaria transfer, how is it transferred exactly?
Through the blood. What happens is this: when the mosquito bites the infected person, yes, it sucks the infected blood, and they took the infected blood and bite another person who is uninfected. It deposits the infected blood, infected parasite in the one who is not infected, and in that way the infection can be transmitted from one person to another.
So, do you know any preventive measures against malaria that people can take?
Yes, there are several ways we can be used to prevent this malaria transmission, and the most common one is by using or sleeping in the treated mosquito nets. And we also prevent this malaria by clearing the surrounding, draining the stagnant water to make where this mosquito used to breed. Uh, by keeping the stagnant water dry, that means we have prevented the mosquito from being multiplied. So we drain the stagnant water. We close the windows before sunset by preventing the mosquito to enter the house before sunset.
So as people usually use mosquito nets to prevent the mosquito. So how to face mosquito nets? How do these mosquito nets fight against these mosquitoes?
What the mosquito nets do is by killing or trap this the mosquito, preventing them to bite the person. Yeah. So by trapping this, there is like it acts like a bleach. Yes.
So do these mosquito nets work the same way in different weather conditions? Like some places are hot, while others are cold. Do they
Yes,
work the same?
they work the same. There's no difference. Yeah. And their effectiveness are the same as well.
So can you tell us what are the main medication that someone can take if they have malaria?
Okay, malaria treatment, it depends if the infection is severe or the infection is mild, like simple malaria or complicated malaria. In simple malaria, we use the tablet drugs, and this tablet drugs are called lumefantrine artemether. And we take this at 0 hour. After 0 hour, we take it at after 8 hours. Then we take it every 12 hours for 3 days. And in severe form, we use this artesunate. And artesunate is an injectable treatment. Yes. We give you at 3 doses, at 0, at 12, and 12. Then we proceed with the tablet drug, the lumefantrine artemether, that is in severe form. But when the first line treatment, the lumefantrine artemether and the artesunate has been failed, we use second line drug, the diaquin, sodium diaquin. Yes, it's a tablet drug.
So does malaria have any known vaccines?
Yes, there's this vaccine, what we call RST vaccine. Yes, and this vaccine is given mostly to children from 5 months, and they receive 3 doses. And after these 3 doses, they receive this at 2 years as a booster to increase the effectiveness of this drug, or the effectiveness of vaccine. Yes.
So can you tell us how does climate change affect the people getting malaria?
The climate change bring about what we call this resistance. And most of the time when people change climates, they don't respond normally to anti-malaria. Yes.
So how soon after infection should a patient go to the hospital to get diagnosed?
As long as the plasmodium is present in the blood,
Okay. How soon after infection should a patient go to the hospital to be diagnosed?
okay, it takes 10 days, like incubation period. It takes almost 10 days for someone to start feeling the signs and symptoms of malaria. Yes. And for someone to go to hospital to get tested, it's when he or she started feeling these signs that I'm feeling headache, I'm feeling like malaria. It's when he made decision to go to the hospital for malaria test. So it takes about 10 days after being bitten by the infected mosquito.
So, do you know the long-term effects of getting malaria and how do these effects affect people?
The long-term complications of the malaria, there are several of them, but just to mention a few, this brain damage, yes, because of repetitive convulsions, repetitive seizures, there's this low oxygen supply to the brain, and it leads to brain damage. When there is this brain damage, a person cannot function properly, like normally. Yes, it can lead to like maybe paralysis. Yes, someone can be unable to talk. Yes.
So, so do how does malaria affect pregnant women?
Okay, malaria can affect pregnant women in so many ways. In this malaria can lead to anemia first, reduced hemoglobin levels of blood in the pregnant mother and also to the baby. And because of this, there can be premature labor starting before normal weeks. Yes, and as a result, there can be premature babies being born. Yes, and because of premature babies, these premature babies, most of the time, they don't survive normally to they don't respond normally to the extrauterine life. As a result, there's increased number of neonatal deaths in Malawi or in Africa because of this malaria. Yes.
So, how are malaria cases monitored and reported?
By most of the time, what happens is this: when someone is being tested positive for malaria, there's a book we use to document, like we call it HIM's book. There's all cases reported at the hospital is documented in that book. And at the end of the month, they do calculate all the cases presenting with malaria, and they do write the report, number of cases reported in that particular month. And after that, they also do the quarterly report. Yes, counting all the numbers of malaria cases from 3 months, quarter, a year, and they report to the malaria control program.
So when a patient is taking treatment for malaria, how do you evaluate his treatment?
Sometimes they do, they repeat the test. If the test come out positive, that means the drug doesn't work, didn't work. If the results came out negative, that means the treatment has been effective. But normally, we don't evaluate it. When someone has taken the antimalarial drugs, is fine, we just say the malaria treatment has worked. But if the patient has taken the drugs and there's showing no signs of improvement, it's when we do the test. That's why it's where we evaluate that. That means there's treatment failed. Yes.
So when a patient comes with a malaria case, how do health officials respond to that case?
When there's increased number of malaria cases, the health officials, they come with strategies to combat, to treat, to prevent, to kill, to reduce the number of cases. And one of the strategies they use to come with, they do conduct this what we call campaigns. And during these campaigns, they provide health education to all the people, the community, how to prevent this malaria, the importance of sleeping in the treated mosquito nets, the importance of keeping the surrounding clean. All these measures or strategies they come up with, these officials, just to reduce the number of cases of malaria. Yes.
So how can a doctor treat a person that has malaria and also like another disease like HIV or COVID? How can they treat such a patient?
Mostly they treat according to the signs and symptoms that someone is showing. Yes, if a person is showing signs of malaria and the malaria has come out positive, they do treat malaria. If they do test and malaria is negative, they rule out other diseases like COVID. If COVID become positive, they treat signs and symptoms of COVID and they give treatment according to guidelines what they should do if someone is being infected with COVID-19. If someone is HIV positive, they also treat according to the guideline. They give this what we call the antiviral drugs to treat. The more and mostly we do treat the signs and symptoms, and most of the time we use the results. We base our treatment based on the results of the patient. Yes.
So which is the most vulnerable group of people affected by malaria?
Children are the most vulnerable group of people. That's why this vaccine RTS is targeting children, and that's why we use this vaccine from 5 months old up to 2 years. Yes.
So is treatment for children and the adults the same or is it different?
The treatment, the type of drugs is the same. What differs is the dosage. And in children, the doses are calculated according to the body weight. While in adults, there is this standard treatment. Yes.
So as we have learned that malaria is usually transmitted by mosquitoes. So can you tell which types of mosquitoes usually transmit malaria?
Mostly in Malawi, this Plasmodium falciparum is the most common mosquito parasite which cause malaria. Yes.
So is this mosquito the only one that transmit malaria or are there other mosquitoes?
There are other mosquitoes, but normally in Malawi is this Plasmodium falciparum, and there is in rare cases they use this Plasmodium vivax. Yes. And this malaria, but in rare cases. But most one is this Plasmodium falciparum.
So how do health officials teach the community that reporters of malaria prevention and how to prevent malaria?
Most of the time what these health officials do is like what I've already said, like they do conduct the campaigns. Yes. After evaluating the effectiveness of this treated mosquito nets, evaluating if the people are really sleeping under the treated mosquito nets, if the people are really taking the measures like draining the stagnant waters, closing windows. After evaluation of all this, if there is still increasing number of cases, that's why they come up with this campaigns like giving education to the whole community or to the whole people surrounding the areas like Malawi, or targeting the whole Malawi. Yes. And during this campaign, they also do all the things I have already said, like educating them how to prevent this malaria.
So after being treated for malaria, is the patient required to have any special diet or should they eat the way they were eating before?
No need for special diet. Like they should eat like they used to eat before. There's no need for special diet. No need.
So do you know any organizations that help with malaria prevention and protection?
Like in Malawi, the common one is this: the malaria control program is the one normally do deal with this malaria, like the one who must conduct these campaigns, like the one who normally submitting this nurse to the hospitals around the whole Malawi to distribute to the people.
Come to the end of our program. As we are going today, we have seen a lot of things to know about malaria. And I've been your host, kam'mwamba. Until we meet again, thank you very much.